We will discuss about the accessory nerve, the 11th cranial nerve. So our topic of discussion is the 11th cranial nerve. 11th cranial nerve, it has basically two components. One is a cranial component, another one is a spinal component. Cranial component, it comes out from the medulla. Say this is a section of the medulla, pyramid, olive and inferior cerebellar peduncle. Pyramid, olive, inferior cerebellar peduncle. So this one is the pyramid, this is olive, this here lies the inferior cerebellar peduncle. We are having the foramen magnum. This medulla oblongata is continued downwards as a spinal cord, and here we will get the first 5 cervical spinal segments. Okay. Gray matter will be here, the H-shaped anterior gray horn, and this is the posterior gray horn. Outside that, we will get the jugular foramen. The jugular foramen has the 3 compartments: outer compartment, middle compartment, as well as the anterior compartment, middle compartment and posterior compartment. In the neck, what are the structures we expect? Soft palate, tongue, hyoid bone, thyroid cartilage, cricoid cartilage, behind it we are having the pharynx. We are having the pharynx here. Two carotid arteries, if we see, at the border upper level of the thyroid cartilage, it divides into external carotid, internal carotid arteries. This is the internal jugular vein. Thyrohyoid membrane, cricothyroid muscle. See, the vagus nerve. Let us first see the vagus nerve. It passes between the carotid artery and the jugular vein through the carotid sheath. Vagus nerve has its sensory supply known as pharyngeal branch of vagus. This is a sensory nerve. Vagus nerve has a sensory supply from the larynx, known as the recurrent laryngeal nerve of vagus. The vagus nerve has a sensory supply from larynx, the internal laryngeal nerve. It has also a motor branch to cricothyroid muscle. So these are the branches of the vagus nerve. These are the branches of the vagus solely. Sensory branch, pharyngeal branch of vagus. Internal laryngeal, it is a sensory branch. External laryngeal, it is the motor branch. Recurrent laryngeal, it is the sensory branch. So these are the components of vagus true. If we see the cranial part of accessory nerve, cranial accessory, that comes out from the nucleus ambiguous present in the medulla, absolutely a motor nucleus. The fiber comes out between the olive and the inferior cerebellar peduncle. The fiber progresses towards the jugular foramen. This is absolutely, it is a motor nerve. Spinal accessory, spinal components. From the anterior horn of the first 5 cervical segments, the rootlets originates. Absolutely motor. They unite together, ascends upward, enters to the foramen magnum, approaches to the jugular foramen, meets with the cranial accessory. So, in the jugular foramen, we get the accessory nerve. This is our accessory nerve of 2 components. What we get in the jugular foramen. Just after the jugular foramen, just coming out of the jugular foramen, these 2 components again get separated. The cranial accessory, it joins with the vagus, and the spinal accessory, it goes to the opposite direction. See what happens to the fibers of cranial accessory. The fibers of cranial accessory, it is carried by the vagus. It has no independent existence. This is the motor fibers. It is carried by the vagus, the motor fibers. Fibers are distributed by the pharyngeal branch of the vagus to supply to the pharynx, to supply to the soft palate. So this is the motor supply to the pharynx, motor supply to the soft palate. Also descends down. By the recurrent laryngeal, the fiber is distributed to the larynx. And this is the motor fibers. So all muscles of the larynx supplied by the cranial accessory, all muscles of the pharynx supplied by cranial accessory, all muscles of soft palate supplied by cranial accessory, except one for each cases. Okay. So majority of the muscles of soft palate supplied by cranial accessory carried by the pharyngeal branch of vagus. Majority of the muscles of pharynx are supplied by the cranial accessory carried by the pharyngeal branch of vagus. Majority of the muscles of larynx are supplied by recurrent laryngeal nerve carried by the cranial accessory nerve carried by the recurrent laryngeal branch of vagus. And it has lastly some cardiac branch. So mainly 3 branches. One goes to the along with the pharyngeal branch of vagus. One goes along with the recurrent laryngeal branch of vagus. Another cardiac branch. So see, this recurrent laryngeal branch of vagus, it is basically a mixed nerve. It has sensory component and motor component. Sensory components comes from the vagus. The motor component comes from the cranial accessory. Pharyngeal branch of vagus, see, it has also the sensory component and motor component. Sensory component of vagus own, motor component from the cranial accessory. Whereas the superior laryngeal branch of vagus, who are having the sensory component of vagus own, and motor component also of vagus own. So cricothyroid is a muscle that is supplied by the vagus fibers. Now this is all about the cranial accessory. Now what happens for the spinal accessory? Let us draw the side of the neck. So this is the mandible, this is the mastoid process. So here we expect the sternocleidomastoid muscle. So if this one is the sternocleidomastoid muscle that divides the side of the neck in two divisions, one is an anterior triangle anteriorly, one is a posterior triangle posteriorly. This will be the posterior belly of the digastric muscle, and here we also expect the stylohyoid muscle. এই দুটো মাসল এখানে থাকে. From angle of the mandible to the mastoid process, if we take an imaginary line, first let us take the midpoint of the imaginary line. The spinal accessory nerve first time appears in here. So here it appears in the digastric triangle. Now it passes below the posterior belly of digastric and the stylohyoid muscle. It appears in the carotid triangle. It is present in the carotid triangle here. If we see the boundary of the carotid triangle, see the spinal accessory nerve present in the carotid triangle. Here, this is a digastric triangle. The spinal accessory nerve present in the digastric triangle. Now it reaches the anterior border of sternocleidomastoid at the junction of upper 1/4 and lower 3/4. So it comes below or beneath the sternocleidomastoid muscle, reaches the posterior border of sternocleidomastoid, comes out at the junction of upper 1/3 and lower 2/3. It lies over the levator scapulae muscle, and here we get the trapezius. So this one is our trapezius, and this is the levator scapulae. While passing beneath the sternocleidomastoid, this nerve gets related with the lymph nodes in two sides. Now it comes out from the posterior border of sternocleidomastoid at the junction of upper 1/3 and lower 2/3. Passes over the levator scapulae, getting plastered in the investing layer of deep cervical fascia at the roof of the posterior triangle. Finally reaches the anterior border of trapezius, 5 cm above the clavicle. So the point where it enters in the trapezius is 5 cm above the clavicle. This is the anterior border of trapezius, where it enters in the trapezius 5 cm above the clavicle. So in its course, it supplies the trapezius, it supplies the sternocleidomastoid muscle. To be noted, the spinal accessory, though it is the major key structure in the posterior triangle of the neck, but it is also seen in the two subtriangles of the anterior triangle. One is the digastric triangle, another in the carotid triangle. So first time it is seen in the midpoint of the line joining the angle of the mandible mastoid process. Then it passes in the digastric triangle. It passes beneath the posterior belly of digastric and stylohyoid muscle appears in the carotid triangle, reaches anterior border of stynochidomastoid at the junction of upper 1/4 and lower 3/4, passes beneath the stynochidomastoid getting related with the lymph nodes, comes out from the posterior border of stynochidomastoid at the junction of upper 1/3 and lower 2/3. It passes over the levator scapulae muscle, getting plastered in the investing layer of the deep cervical fascia at the roof of the posterior triangle. Now reaches the anterior border of the trapezius. It enters in the mass of the trapezius 5 cm above the clavicle. So this is the entire root of the spinal accessory nerve. So it is the main nerve of the posterior triangle. Spinal accessory, it is the main content or the key content in the posterior triangle, but it is also seen in the anterior two triangles. So here we get the spinal accessory that supplies the sternocleidomastoid and trapezius, and here we get the cranial accessory that supplies the soft palate, that supplies the pharynx, and that supplies the larynx. That's all.